You see that, Ariel?
Recording in progress.
Good morning, everyone. We will go ahead and get started. There is a copy of the Open Meetings Act located on the wall of the legislative chambers, and it is also on our county board website. Please stand for the Pledge of Allegiance.
To the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
I also forgot to announce there's the automatic external defibrillator on the back wall of the legislative chambers as well. Before we get started with our agenda, we would like to welcome our newest board member, Commissioner Garcia. Welcome and enjoy. Have fun, that's right. With that, we will begin with the agenda for the Douglas County Board of Equalization. Roll call, please.
Boyle. Here. Kavanaugh. Friend.
Here.
Garcia. Here. Morgan.
Here.
Rogers.
Here.
Madam Chair.
Present. Item A, approval of the minutes of the Board of Equalization meeting held Tuesday, October 26, 2021. And item B, call for a meeting and set Tuesday, November 9, 2021 as a date for hearing on certified assessment corrections reflecting the addition of omitted property to the tax rolls or increased value on property. Is there a motion to approve A and B?
Second.
Motion by Commissioner Morgan, seconded by Commissioner Friend. Any questions or comments? Please vote. Citizen comments. Is there anyone in the chamber wishing to speak to the Board of Equalization about an item not on the agenda? Seeing none, we will move to resolutions. We have resolutions D through J. Is there a motion to approve and adjourn?
Commissioner, may I, Mike Goodwillie, Douglas County Assessor, Register of Deeds Office. Congratulations, Commissioner Garcia. If I may suggest that before you do anything with the resolutions, you pull F and treat it separately. There are some folks from this organization that would like to address you.
Okay, that'd be fine.
So if you wanted to take everything except F, and then we'll take F after.
Yeah, it's fine. And then I also needed to, on item H, if you look at the sheet that was handed out to you, the wording of the third item where it says, or the second item, the Metro Community College, where it says bond on the original, it should say qualified capital. So you have the you were handed out the corrected sheet there. So with that, if the motion and the seconder are agreeable to removing item F, taking that separate, and are agreeable to that corrected item H, we can move forward with the vote on the rest of the resolutions. Do you have, okay. All right, please vote.
Motion passes.
So with that, we will go back to item F, which is a denial of a 2021 permissive exemption application.
Let me give you the background on that, Commissioners.
Okay.
This is New Bethel Church. They've been a church for a long, long time. The way our process works is exemptions, full exemptions are applied for in years divisible by 4, and in the intervening years, the organizations are supposed to file what's called a reaffirmation, saying basically, you know, the stuff we told you we were doing that you exempted, we're still doing it, okay? There are a couple of statutory deadlines to keep in mind. One is that that reaffirmation needs to be filed by December 31st of the year prior. So for 2021, that reaffirmation application needed to be filed by the 31st of December. An organization can miss that date and still file up to June 30 with a penalty for each month they are late. The way our process works, or what we do in our office is, in November, we send a kickoff letter or email out to everybody we have in the system. And we did that with New Bethel on November 9th of 2020, saying, hey, time to file your reaffirmation. In mid-December, we see who's filed and who hasn't. We send another reminder with 2 weeks to go before that December 31st deadline. There was one that went out to New Bethel December 15th of 2020. Then when we get deluged with applications the last 2 weeks of December, we wade through those, and come springtime, we see who's filed and who hasn't. And we send a third reminder letter, which we did with New Bethel on March 22nd, 2021, saying, hey, you missed the deadline, but it's not too late. There will be a penalty, but you can still get your exemption application. And then finally, around the 1st of June, we see, all right, still who hasn't filed, and we send one last reminder letter, this time June 4th of 2021 to New Bethel, saying, hey, you got to get this filed by June 30. We heard nothing. Finally, New Bethel filed an application on September 20th of this year. There are some people here from New Bethel that would like to speak to you. The letters we sent out, we always use the address the organization gave us on their most recent property tax exemption application. So why the organization didn't respond to any of these letters, I don't know, and perhaps they can explain. But by state law, when we didn't get the applications, essentially that more or less forfeits the exemption. We finally got a late one. And so we did what the law requires us to do, and we sent a notice that we intended to recommend denial of the exemption application. So with that, I'm sure somebody from New Bethel would probably like to speak to you.
Okay, thank you.
Good morning.
Could you just state your name for us?
Yes, Pastor Irvin McSwain Jr. I'm here with my wife, Sandra McSwain. I serve as the pastor of New Bethel Church of God in Christ. Acknowledge that we did receive notices, and we acknowledge that we did not respond. And unfortunately, our mail was going to another New Bethel. In the same block, we have two churches, New Bethel Church of God in Christ and New Bethel AME. We are New Bethel Church of God in Christ. Our mail was going to New Bethel, or not New Bethel, but Bethel AME, and we did not respond timely. We acknowledge that we did not respond timely, but we appealed to this body to allow us to remain as a church under the ordinance. We've been at that location since the early 60s, and thank God I was almost born in that church, so I've been there a while, and I serve as the pastor at this time. Our church was closed down during the pandemic, and we had some individuals who unfortunately got sick. They're well now, but we appealed to this body to allow us to remain in the same status.
Okay, thank you very much. With that, we've heard from the assessor and we've heard from the pastor. Commissioner Rogers?
Reverend McSwain, do you have something of that mail-in that just verifies that it was sent to another address that we can have to note that?
I'm sorry.
Do you have some samples of that mail that verifies that it was sent to the wrong address?
To another church?
Do you have copies of that mail that shows that it was sent to the wrong address?
We didn't send it to the wrong address, it just didn't get delivered, right? Is that your address?
Yes.
Okay. I don't think it was a case of sent to the wrong address. I think it was delivered to the wrong New Bethel. And for whatever
Well, that's
reason.
what I mean, wrong address or whatever.
And for whatever reason, the other church didn't pass it along to these folks.
Oh, I see.
But that's what I'm saying. You got,
Mhm.
it's clear though that it was sent to the wrong New Bethel.
Delivered, not sent.
Yes, delivered.
Yeah.
That's clear, and I'm not sure whether we have a copy of that.
No, I mean, I just got it cleared in. I got it cleared
Yeah.
right there.
Okay.
I would make a motion to, whatever the proper motion is,
Grant the
to
exemption.
grant the exemption.
Second.
Okay, any other questions or comments? Commissioner Maureen Boyle?
No, that was my question.
Oh, okay,
Thanks.
all right. Okay, with that, no other questions or comments. There's a motion by Commissioner Rogers, seconded by Commissioner Morgan. Please vote. And that did include adjournment. Yeah. Okay, thank you for being here today.
Let's chat out in the hallway, okay?
Thank you so
for
very
being,
much.
Yep, thank you for being here today. With that, we will move to the agenda for the Douglas County Board of Commissioners. Roll call, please.
Commissioner Boyle? Commissioner Kavanaugh? Commissioner Friend?
Here.
Commissioner Garcia? Commissioner Morgan? Commissioner Rogers? Madam Chair.
Present. Item A, excuse me, approval of the minutes of the Board of Commissioners meeting held Tuesday, October 26, 2021. The minutes from our pre-board meeting are available on the web. And item B, approval of the claim submitted for payment process through Tuesday, November 2nd, 2021. Is there a motion to approve A and B?
So moved. Second.
Any questions or comments? Motion by Commissioner Morgan, second by Commissioner Rogers. Please vote.
Motion passes 6-0.
Next is our consent agenda, items A through G. Is there a motion to approve? Motion by Commissioner Rogers, second by Commissioner Morgan. Commissioner Garcia? I'm sorry, what number?
B as in boy.
B as in boy, yes. All right. So with that, we will, is the motion and the second are okay with approving A through? What was it? A through G minus B. All right, please vote.
Motion passes 6-0.
We will now go back to item B, approval of the grant-funded consulting agreement to assist the creation of a community family resource center in Douglas County. Commissioner Garcia?
Yes, I had a constituent that just wanted a little bit more context on these family resource centers, just a little bit on the background of who we anticipate running these, and I'm sure it's in the very early phases, but nonetheless, just a little bit of background on this initiative.
Sure. So Commissioner Rogers and Kim can jump in, but we did an environmental scope of the need for a community resource or family resource center and what that would look like, and that came back, and it was moving forward with it, and it's more of a concept of like a hub and spokes. So there'll be a community family resource center within the communities, but that's all being developed and talked about right now. This actually helps move that agenda forward so that we can come up with our plan and implementation process for doing that. And so that's what this agenda item is bringing on a consultant to do that and help us get to where we need to be with that idea.
Definitely, thank you. And if somebody wants to plug in a little bit on that conversation and just learn more, is there a specific committee or place they can go?
Commissioner Rogers is the chair of our Child and Youth, and he has had reports out about the Family Resource Center, and I assume, I'm not talking
no.
for him, but he'll continue to.
No, two weeks ago, we had a Child and Youth Service Committee where this was the sole agenda. It was open to people from the public. They commented on it, went through it in detail about how it is. This actually is an agreement to now put the rubber to the road and implement it. So for the last year and a half, it's been the study, talking to community members. So this agreement actually is now implementation to start structure and other things of that sort. So yeah, it's been regular updates for the last year and a half, with the last one closing on the report and what the finalization was of it 2 weeks ago.
I appreciate that context. Thank you.
And Commissioner Garcia, we can have a sit-down for you to get from the beginning to now to understand the details a little bit better and actually get you the copy of that environmental study that was done on it.
That'd be great.
Okay.
Thank you.
Commissioner Boyle.
Just a quick comment, is that, Commissioner Rogers, that committee meeting was actually very useful, very valuable, and it had a lot of information about this exact thing. Is that available online? Because that may be where
Yes, clerk's office.
Okay, so I think that anybody who's in the audience who wants to hear about that meeting, I think it was very specific, and Kim Havakati did a great job just explaining what the spokes are and what the nature of this whole thing was. And so I got a lot of clarity out of that, so that the fact that it's online, I think, could be helpful. And it was the Child Services Committee.
Child and
Youth Service.
Child and Youth Services Committee from about 2 weeks ago. So that's online.
With that, is there a motion
Motion to approve.
Is there a second? Motion by Commissioner Rogers, seconded by Commissioner Morgan. Any further questions or comments? Please vote.
Motion passes 6-0.
Next are our recognition and proclamations. Are any of the retirees present? With that, we do have 3 retirees, one from our health department, Carol Beth Isaac, one from our county court, district court, 17 years is Doug Johnson, and then one from our public defender's office with 22 years is Christy Filkins. Is there a motion to approve the recognitions of these employees' retirements?
Motion approved A through C.
Motion by Commissioner Rogers, second by Commissioner Morgan. We wish them well on their retirement and thank them for their years of service. Please vote.
Motion passes 6-0.
Citizen comments. Is there anyone in the chamber wishing to speak to the board about an item not on the agenda?
Good morning. Larry Storr, 5015 Lafayette Avenue, Omaha, 68132. I do want to compliment this body for having some somewhat reasonable rules, because you do allow citizen comment time of maybe 5 minutes if you're not out of order. Most of the other bodies around this town do not. Had a confrontation about that at the Omaha Public School Board last night. It wasn't just me. I want to point out today, however, that last week at the city council meeting, something happened that made me decide I was not going to keep my mouth shut. But there's a person that runs around these chambers, apparently, this building, and he is maybe not currently actively paid by anybody, but I suspect he's still an independent contractor of an organization called Noise. I'm submitting you some information today that proves some of the things I've been saying. Nobody can write these kind of articles about even your body unless they have been talking to you. And I occasionally have seen him leave this chamber to go back there to try and find somebody, or out there to get an interview. And I've seen him out there interviewing somebody when I left. One day I asked him if he was a reporter, and he said, "Larry, don't go there." Well, he's been acting pretty strange ever since that. Last week at the city council meeting, he marched in here and sat down right next to me, minus one chair, more or less a threatening way. So I began asking myself, why? Well, this is why. These are all the articles he's published in relation to this body. You can't get that information here when you're here. You don't tell us that here. He's been getting it through private interviews or something, or other sources. But I don't know how they can get those words that they print in these articles. Question is, why do these people have more access in these chambers than a citizen? Why do they get more access to you than a citizen? NoiseOmaha.com, you can get more information. They do get citizen community partner funding, which must be, some of those organizations get some funding through this body or through the city council. You can look it up. It says it on their website, who their partners are. So anyway, I want to run through just a couple of these while I've got time. Coronavirus relief bill, juvenile justice by Dwayne Lamont Hayes and Luis E. Jimenez. Lost alternative, solitary confinement in Nebraska. Solitary reform goes to the legislature, so he's busy down there too. Does downtown Omaha need another jail? He gets rather specific on Mr. Jim Cavanaugh quite a few times. These people also members of an activist group. It's in these documents. That meet at the Gluckser House. They're all citizen journalists, I guess you might call them. They use their blogs, but they one of the documents in here says, well, you can get paid for that. So I expect this body to ask Lewis next time he comes up here and does not disclose who he represents, other than saying, I represent myself or my neighbor, and then giving 2 or 3 addresses. City council last week, they were all chuckling about that. I don't find that funny, not at all, when he refuses to disclose stuff. And then he moves around every week. I don't know, sometimes he gave them both addresses.
1 minute.
What's up with that, folks? You need to question people like that. But I am filing a complaint about that, and this is my supporting evidence. I did email that too.
Thank you. We do have someone on Zoom with their hand raised, and I can't read the name. Tracy Baker. Good morning, Tracy.
Yes. Good morning. Thank you for your time. I do have comments, but it is for an agenda item. It would be after Dr. Hughes speaks regarding COVID-19 questions that I have.
Okay, if you can just keep your hand raised, we'll have Dr. Hughes give her report, and then I'll call back on you.
Much appreciated. Thank you.
Okay, thank you. Anyone else wishing to speak to the board about an item not on the agenda? Seeing none, we will then go with our presentation on our COVID update and our COVID-19 vaccination plan update with Dr. Hughes, who is joining us via Zoom today. Good morning.
Good morning, commissioners. Thanks for your flexibility this morning, and also congratulations and welcome to our new commissioner. I'm very much looking forward to meeting you in person and working with you. Lindsay Hughes, Director, Douglas County Health Department. I do not have the ability to share my screen this morning, so I'm going to be talking you through the data. So I apologize for that in advance, and we'll just take it slow. I will start off by saying that we are still in the high transmission category, so we are not out of the woods yet. Today we are sitting at 186.2 per 100,000 for our 7-day total number of cases. So we have, over the past few weeks, been declining in our numbers, which has been very encouraging. Over the past week or so, our numbers have climbed back up a little bit. I think it's safe to say that overall the trend has kind of evened out. So I think you could say that we've plateaued again. So we're still sitting in that high category. We're certainly not seeing the fast decline in numbers that we saw a year ago when we had a similar, much higher outbreak. Of course, we didn't have vaccines back then, but the trend is looking just a little bit different than it did last year when we were going through a spike. So right now we're kind of just sitting in that upper hundreds. Still certainly seeing plenty of cases out in the community. Hopefully we'll start to see those come back down again soon. In terms of cases and where we are seeing cases population-wise, we continue to see the highest proportion of those cases, of our cases, happening really in our kids and adolescents. So over time, we saw a slight decline in the number of cases that were happening in our kiddos, but that trend has reversed since about mid-October. That has increased again with the greatest proportion of those happening in ages 5 to 9. So the good news is that we have a vaccine that's coming hopefully in the next week or two. So hopefully we will be able to start addressing this very soon for this age group. But that it has certainly grown quite a bit within that age group. So we do continue to see that, and we are definitely still seeing clusters within our schools, and we are working with the school districts as usual to contain those. There really isn't any surprise in terms of where within the community we're seeing cases happen. So if you think back to what that map looked like in the times that I've shown you our zip code map before, really our cases are showing up pretty much where they have before. So we're seeing high numbers of cases. Zoom. I am able to see my dashboard. I'm sorry that you're not able to see my dashboard this morning. So we predominantly are seeing kind of diffuse cases throughout the community. Again, kind of through that Millard, Elkhorn, Bennington corridor, and then across really through the central area of Douglas County is where we continue to see most of our cases popping up. In terms of hospitalizations, no surprise there, our hospitalizations continue to be very high. So as of yesterday afternoon, we were at 85% occupancy rate for our hospital systems in the region. Again, that's across all hospital systems. So we do have some hospitals that are quite full. We have others that may have a couple of beds. So, but when you take them all together, about 85% full. ICUs are 83% full right now. Pediatric ICU continues to be pretty full at 86%. Right now, I believe 5 of those are COVID patients for pediatrics. And then for ventilator usage, 41 people are currently on ventilators specifically for COVID-19. Last week, we had 7 deaths that were reported, and of those, 5 of them were not vaccinated. That's a pretty common trend that we've seen with the deaths that are reported. I've really seen between 75 and 83% of the deaths that are reported are unvaccinated. So really predominantly what we are seeing is that the sicker patients are more than likely to be unvaccinated. So of course, that means that we continue to really encourage people to become vaccinated. Our breakthrough rate has remained pretty consistent at 1.5%. So again, 1.5% of the people who have been fully vaccinated have gone on to develop a COVID-19 infection or have tested positive. So that is what we continue to see here. The death rate out of that has been 0.01%. So again, that kind of bears up when you're looking at that, the hospitalization and death rates, that severe illness happens more frequently in those who are unvaccinated, and those who have been vaccinated and are unfortunately in the position of being hospitalized or who unfortunately pass away have tended to be either quite elderly or have some situation that has led to their immune system being compromised. A little bit more about vaccinations. So we are slowly moving up as we have been. Currently, 74.6% of our eligible population is vaccinated with at least 1 dose. 61.8% of our total population has had 1 dose. And then in terms of being fully vaccinated, we hit 58% for our total population, and then 70.1% of our eligible population. So that we've finally kind of reached that benchmark for at least our eligible population. And of course, our eligible population is changing imminently. So we are hoping that we're going to be able to start giving vaccine to our 5 to 11 residents very soon. We just have a couple more steps we have to clear in terms of ACIP sign off, CDC sign off, and then we will have to actually receive vaccine. So we aren't drawing this out of our existing stock. We will actually have to get pediatric vaccine formulation ordered and sent to us, which all of those logistics are in motion right now. We are hoping sometime early to mid next week, we should hopefully be able to start giving vaccines. I just don't have a date for you on that yet. In terms of our adolescent population, vaccinating has kind of slowed down there a little bit. 64.6% have at least 1 dose and 58.5% are fully vaccinated. So it's possible that when, our 5 to 11 crowd is ready to be vaccinated, hopefully some parents will decide to bring their older kids into and get those taken care of, fingers crossed. We do continue to have quite a lag in our Black population and our Native population in terms of our getting vaccinations taken care of. So we are working with our community partners to strategize around that and hopefully find some ways that we can both message in a way that builds trust and helps people to feel more comfortable with getting that vaccine, and also to provide vaccinations maybe in some areas and in some more consistent formats that might be more acceptable. So we're working on that. We are also working on those plans for adolescent and child vaccine rollout. So we are working currently with schools. We are working with pediatricians. We are working with our community partners to best optimize how we can get our 5 to 11 crowd vaccinated. So all of those plans are ongoing. I can't give you specifics right now because everything is kind of fluid and still moving. So please, for anyone who's watching or listening and is interested in this information, if you go on our Douglas County Health Department website, we post information on where vaccine is available through us pretty regularly. We update that website sometimes more than daily. So that's usually a pretty good place you can go to get any information that might be needed there. I also wanted to just give you a quick update on testing. So making sure that free testing is available throughout our community has been a challenge since Test Nebraska went away. So NOMI Health stood up a test site at Oakview Mall, which we felt was a little bit too far west for a lot of our population. And so we did work with them to stand up a couple of other sites. It took a little while, but we do now have 2 other test sites that are open. One is at the Fort Omaha Metro Community College, and the other is at the South Campus, the South Omaha Metro Community College. Those, I believe, are open 9 to 5 daily, except for Saturday, it's 9 to 3. And then I don't believe they're open on Sunday. So Sundays are closed, but otherwise, those are when those free testing sites are open. So they will ask for insurance, but no patient will be billed for testing. So they may bill the insurance, or they may bill the federal government if the person doesn't have insurance, but no patient should be charged for their testing. So I wanted to make sure that we got that out through another avenue. And I know a lot of people reviewed this particular meeting. So I wanted to make sure we brought that up. So I think with that, that is all of the information I have for you right now, but I'm more than happy to take questions.
Thank you, Doctor. Commissioner Kavanaugh?
Thank you. Thanks for this, Doctor. This will come as no surprise. The positivity rate is what in percentage?
9.6 this morning.
9.6?
Yes, so it has gone up over the past couple of weeks. So I think the last time I reported to you was maybe 7.7, 7.8.
What can we draw from that, if anything?
We still have a fair amount of COVID in our community. I think that is very fair to say. We have had over the past week, it looks like we had maybe fewer people testing, not significantly fewer. Sometimes that can drive that rate to look a little bit higher, but with it being as high as it has jumped, that really is an indication that, you know what, we still have a lot of this in our community. And of course that doesn't capture people who are testing at home and those who are symptomatic and who aren't testing.
So with these kids coming online, the under 12s, do we have an idea in Douglas County what number of kids fall into that category?
I believe when I last checked, there were about 60,000 in the 5 to 11, give or take. That's kind of an estimate. We, from what I hear, will be getting about 20,000 doses from the state to start with. So we'll be able to vaccinate about a third of those to begin with. And then I would assume that that will, you know, based on kind of how our efforts are going, we'll be able to order more from there. That information is still fluid and changing based on the situation. So that could change an hour from now or a day from now.
Sure. And I think you indicated that the preparations are in place for getting those vaccinations into kids' arms as quick as possible.
Yes, absolutely. We've been working with schools across the county to use their facilities and you know, go through the schools. We've been working with FQHCs. We've been working with other providers in the community. So we are definitely looking at the best way we can get those out.
Okay.
And we are also looking at messaging. So I also want to say that this is something that the health systems and partners, we've all been talking about how best to also message around the vaccine and you know, overcoming some of the hesitancy that remains there. So there's a lot of work going on behind the scenes with this right now.
That's great. Thank you.
You're welcome.
Commissioner Maureen Boyle.
Hi, Dr. Hughes. So first, you know, when we look at that map, we see that West Douglas County corridor that always seems to be positive. Do you have that in percentages? Is that a per capita thing? So I'm just curious. I know most of the population is there, so I expect that number to be higher.
Yeah, let me look here real quick. I think the cases are counts. But let me look here to see if one of the other ones might have it in a format.
If you don't, then I'm just curious, like next week when you come, I'm just curious because I know, like, again, because most of the population is heading that way, if it's per capita, that would make sense. If it's a percent, that would kind of spell out a little different picture. So, and that's fine if we can do that like next week or something.
I'll talk to my EPIs about that. Right now, it looks like just counts.
Just counts. Okay. All right. And then second, you mentioned the 70% threshold being met. How many first-time people are you seeing getting vaccinated at this point? Like, give it a ballpark picture. Or what are their what are their reasons?
I'm sorry.
So are they stating why they waited so long if you're seeing many of them?
You know, I'm not hearing reasons necessarily other than, you know, a lot of times you'll just hear they finally talked to somebody who made it click for them. So it might have been that they talked to their physician and their physician finally made it click for them, or they might have talked to a friend or a neighbor who explained it just in that way that made it make sense for them or made it feel comfortable for them. So I have heard anecdotally stories like that. I don't know that there is necessarily a trend where a certain message itself has made an impact, you know, to most of the people coming in. I can say that we have seen a lot of people coming in for boosters. I just don't have a breakdown of the boosters versus first time. So what I'm giving you today is all first. So the data that I'm giving you is all initial series. We do have people also coming in to get their boosters, and we just don't have that data isn't broken down real great between third dose and booster. So once that's in a cleaner, nicer format, I think we can probably talk more publicly about that data. It just isn't in a great reportable format right now.
All right, and then the 85% hospitalization or occupancy rate of hospitals still really makes me nervous, and so just to make a point. And I just want to stress once again the point that pregnant women are especially susceptible to this disease, and the vaccination rates are just ridiculously low, like in the 30%. And we do see intrauterine fetal demise or stillbirth more often. So as an OBGYN doc, I just want to make that point once again, that we need to really stress our pregnant folks get vaccinated. We see more preterm delivery as a result, purposefully, because the placenta is not functional because of blood clots from COVID. So bottom line is COVID is a bad thing. COVID vaccines in pregnancy are not a bad thing. And then along the line of hospitalizations, to have the ICUs 83% full and pediatric ICUs 86% full, that's just scary stuff. So those numbers have been staying in the 80s and only going up and down in the upper 80s is what we've kind of been seeing lately. What are you hearing from the hospitals?
Basically that they're also, they're tapped.
1 minute.
They just don't have a lot of staff to take care of this. It's very scary for them as well. You all know that these high hospitalization rates, and yes, we went into the 90s for several days last week, which was, my heart stopped.
Yeah.
We can't take care of sick patients right now. We are struggling mightily to take care of sick patients right now. And so we are definitely just hearing a lot of exhaustion and fear from our providers in the hospitals because they're burned out.
Are there any solutions that you've heard or anything different we could be doing differently?
No, if we can find some more staff to hire, that would be fantastic. So a lot of the issue is staffing. Again, that's a challenge that we're seeing nationally. We're seeing everywhere across.
Commissioner Garcia?
Yes, briefly on the topic of boosters, I was wondering if there will be any upcoming campaign on messaging related to boosters. Should the average citizen who's been fully vaccinated, should they be seeking their booster at this point? Are we rolling out some kind of campaign that kind of guides the average citizen on that, including myself? And is this something they could get at, for example, the South Omaha clinic at the Metro Community College that you mentioned, or do they need to go through their private physician? Which makes it a little tougher for some. And combining that with knowing that, a year and a half ago, with the meatpacking plants really being ravished and having a very difficult time with the population there, especially in South Omaha, getting COVID. Luckily, at this point, a lot of those individuals have been vaccinated and the corporations are, putting their effort into ensuring that it happens. But my main point being now, almost a year later for some, should they be seeking their booster? How do they go about it? And what will be our kind of messaging rollout with that?
Great question. So right now we're not recommending boosters necessarily for just everybody, but the groups that we are recommending it for are pretty broad. So anybody over 65 definitely qualifies for a booster, should absolutely seek one out. Those between 16 and 64, if issue that puts them at higher risk for COVID, absolutely seek out a booster. And then if anybody in those age groups works in an environment that puts them at a higher risk for COVID, they should also seek out a booster. So when you're talking about the meatpacking plant, absolutely, we saw some crazy outbreaks nationally in our meatpacking plants. I know especially here in Nebraska, it was a big struggle. So we can work with organizations, employers, groups like that to stand up. If it's easier to kind of get everybody through in a couple days, if they would want to set up a special clinic just for their employees, those are things that we've done in the past that we can certainly do again. Any of our sites offer boosters. So, you don't have to necessarily go through your physician to get that, although it's always a good idea to talk to your doctor, and see what their recommendations might be. But if you want to come into our, the South Omaha Metro Community College site or, wherever, we will give you a booster. So we have boosters available at most of our sites. So one thing I do want to say though, and this came up last week, is that we are with our pop-up clinics. So our pop-up clinics are very small. So those are usually staffed with like 2 people, like 2 clinical staff. We are only offering one type of vaccine at those clinics right now. So some of them are Pfizer, some of them are Moderna. Probably some of them could be J&J if we wanted to do that. But right now we're kind of focusing on those other ones. Keep in mind too that booster mixing has been okayed. So if somebody wants to get a booster that's a different kind from their initial series, that's okay to do. So if they want to come to a clinic that's a different kind than what they got initially, that's acceptable, and we will accommodate that too.
Okay, so final wrap-up question to the conversation here. So somebody like my 61-year-old father-in-law, who formerly meatpacking for many, many years,
1 minute.
who is partially handicapped now and doesn't have a primary physician and doesn't have health insurance, and got their vaccine about 7 months ago, fully vaxxed, what would be their route? It sounds like they probably should seek a booster. And what would be the easiest route for somebody like him to get that booster?
So if he doesn't have a primary care booster, he can go online to our website, and there will be a link there. So there's a button that will say something along the lines of where to get COVID-19 shots. Can click on that, and it will list where all of our sites are. And really just he can make an appointment. He can, if it's one of the community ones, he can just come in during the hours that we're open. There are also other places that are offering vaccines. So I know pharmacies are offering boosters and vaccine there. So he can go in several different routes.
Thank you.
Commissioner Maureen Boyle?
I just have one more question. Can you speak to the school closing in Millard?
Absolutely. Well, yes, I can. So there is a school that closed over the weekend. So on Sunday, the superintendent there did opt to close Black Elk Elementary, and that was due to the number of classroom closures that had occurred there. So, and that was on our radar. We were aware that there had already been a number of closures there. We were working with them very closely on that. We did talk on Friday and just, put that on the radar there that they were sending a lot of people home. We don't close schools, so I want to be very clear there that the health department does not close anybody. We certainly can make recommendations, but we don't actually close anybody. So we did have conversations with their health services staff and with their superintendent. And then on Sunday, because they had more cases that had come up over the weekend, they did make the decision to go ahead and close. My understanding is that they are closed through maybe the 29th. And so they are taking, I think, a very good approach to trying to get this under control. And we will continue to monitor, work closely with them and also monitor cases that continue to occur in that school even during their closure.
Are there any other schools on your radar like that?
Not that have had that number of cases. We've had several schools that have had more than one classroom closure, but we haven't had it to this extent. So this is the first time that a school has opted to close because of their number of classroom closures. And my understanding is that they also had a number of teachers that were either out because of COVID or because they had children out with COVID. And so it was not only an issue of the kids being sick, but also staffing. So, and any specific information related to that, the district would certainly know. But we certainly support their decision to do that and to get this under control.
All right, perfect. All right, thank you.
No other questions from board members. There is Dr. Hughes, someone from the public that has a question or comment. And so I will call on Tracy Baker again. And Tracy, there we go.
Hi, can you hear me okay?
Yes, ma'am.
Okay. So just a few comments to make as a concerned parent of a 10-year-old. I live in Bennington. I have no representation on the City Council of Omaha or the Bennington City Council, so I am relying on Douglas County at this point in time. I have a daughter that is prone to upper respiratory infections and pneumonia. And thank God I decided to homeschool because she was one of the classes at Bennington's Pine Creek Elementary, where her classroom was shut down several weeks ago due to a spread in cases. I guess at this point, Dr. Hughes, I feel bad that you are in the position you are in, but for the fact that we have schools now shutting down, I would think, much to the dismay of Governor Ricketts, I wish you'd issue a mandate anyways, because that's obviously what we need at this point in time, and let him take this to court, because this is getting out of control, in my opinion. I think including in your presentation weekly, we should be seeing numbers by schools and comparing those that have mask mandates versus those that don't. For the fact that so many classrooms and now schools are shutting down, and this didn't happen last year, proves that masks work. I heard that the Millard School District, you literally have parents still in denial and wanting proof that there were, of the COVID positive tests that are coming out of Black Elk. I find that just appalling that these parents feel this way. And my only other thing I would like to see is that, we keep track of breakthrough cases of those that are vaccinated. I'd like to see breakthrough cases of those that think they have natural immunity from a prior COVID infection. How many of those people are being hospitalized? CDC just had another study come out last week showing that, getting a vaccination on top of your, quote unquote, natural immunity is better. I'm tired. I mean, even my own family members have had COVID and don't think they need that vaccine, which frustrates me. But like I said, we see the percentage of breakthrough cases for vaccinated. Let's see the same thing for those who think they have natural immunity. I think it would help prove that, vaccination for those individuals is what needs to be done as well. So thank you for your time. That's all my comments.
Thank you, Ms. Baker. I really appreciate your comments, and absolutely, we want people to get vaccinated regardless of whether they've had COVID or not. That immunity that is provided through becoming infected is not, it's uneven. So some people may develop immunity for a couple months, some people don't. And so really immunity is the most consistent and the strongest immunity for the longest period of time that you can get. So we definitely do encourage that. And I very much appreciate and feel your frustration around what's happening in the schools. And I know.
Well, like I said, I mean, when I got the call, we're supposedly dual enrolled so that my daughter, she's in 5th grade, so that she can still go to recess. And like I said,
Ms. Baker,
that we're homeschooling, so.
Thank you, Ms. Baker.
Thank you.
Yep, you bet. Thank you very much for your time this morning.
Absolutely. Ben Salazar?
You're muted, Ben.
Nope, you're still muted, Ben. There you go.
Thank you for the Hollywood, man. Happy birthday wishes for my Halloween birthday is what I was saying. So, and boo to you all. But good morning, thank you. And Dr. Hughes, good morning. But I wanted to supplement what Dr. Hughes was mentioning as it pertains to South Omaha. What I've discovered in my tenure in the last year and a half with the department is the most amenable and the quickest way for especially the older folks, people like myself who are a little bit clumsy or maybe don't even have a computer, is a telephone. a telephone call will do two things: line up where they can go get a shot, and if necessary, where people can come to their home to give these folks a shot. So that system is currently underway through our propaganda, our public relations, and material that we're spreading through South Omaha. But the other way is for the elderly, and I run across this frequently, is many of them have children, grandchildren, relatives who do assist them, who do help them. So for those few folks, I think the percentage is somewhat small, who are living in isolation to a large degree. I think the new and upcoming, and maybe still under design, the mobile units that are under consideration from the department that will roll out, and I don't know if they've rolled out yet, Dr. Hughes, or not, but they're planning to roll out at least one into the neighborhoods, which I think is a fantastic idea, because this will reach into the corners of the communities where maybe we haven't been before. So there are some rollouts, and so there are some options, but I think the numbers in South Omaha are still increasing in terms of vaccinations. And for my part and my colleagues, we're still going to continue to do the best we can to gently push our folks to get vaccinations. So there are other methods that are being implemented as we speak. And one other thing that I don't know if it's been implemented yet, Dr. Hughes, but I think there was a grant proposal under consideration to place a health worker in both North and South Omaha. I support that thesis. I support the idea. Personally, I would prefer 2 or 3 health workers in one location, because I think the activity would increase, just the number of folks once they discover you're there, the health department is there, a shop is open. I think you're going to see a growth in significant in numbers of people that are walk-ins, wanting to get information, wanting to have person-to-person access. In our community, person-to-person access is so important. Anyway, my 2 cents. Thank you for the time. Appreciate it.
Thank you.
Thank you. Yes, and we will come to your house. So to Mr. Salazar's point, if somebody wants to actually pick up the phone and call our line, they can actually schedule a time, and we will come to your house to give your vaccine. So
Yep.
Front door service.
Yeah.
Let's just take a quick peek here at the gallery and make sure we have no other hands up. Okay. No other questions or comments? Thank you, Dr. Hughes.
Thank you.
There is one thing I meant to come on down, Larry, but when Roger was talking about how do you determine if we could send him that map that the health department did of it outlines, like, if you're vaccinated, yes, and then it goes down and there's some more boxes as to another question. Then if you answer that question, it goes down to another box, and it answers that question. So like me, I'm not compromised, but my husband is compromised. So what does that mean? And that will help when you're talking to your folks to go through that little map, and then it'll determine yes or no should they get a booster. It was really a really, really good map. So.
Yep, happy to do that.
Great. All right, Larry.
Larry Store, 5015 Lafayette Avenue, 68132. I guess first of all, I need to clarify if this is one of those presentations where you can have back and forth communications. 2 of your guests seem to be doing a presentation of their own. The main presenter here was Lindsay. Now, there was some back and forth maybe with Lindsay, but there were some speeches in there. And I think probably that was a little bit out of order. There is some discussion that there are no rules in this body, or you make them up as you go. So I'd like clarification on what's the difference between a presentation where we can do this versus a testimony on an item where we cannot do this for the citizens. But also, there is such a drumbeat to try and force everybody into masks and force everybody into vaccines. And now they're going after the 5 to 11-year-olds. Just last night, now I suppose all the news I read is fake, but Johnson & Johnson vaccine seems to be causing blood clots. Why in the heck would I tell my grandkids to get that shot when there are too many people that disclose health risks due to vaccines that we don't know anything about? They're not proven over a period of time, a lifetime. I may have natural immunities. I may not. But I am not going by what seems to be experiments like Adolf Hitler conducted back in the 30s. Maybe, yeah, 30s probably. Not unlike it. But the government is rushing us to this. You guys are buying into it. You maybe need to think about the overall public safety of this. Thank you.
All right, with that, we have no other comments. So again, thank you, Dr. Hughes, for being here today. With that, we will move on to our committees, and under the finance, we have a number of items. The first one is our budget report as presented. Our next one is a approval of a consulting contract with Deb Anderson to assist the county in determining the mental health programs and services to fund with our ARPA and general fund dollars. And as you know, we have talked a little bit, and we'll be talking about it further during our ARPA meetings as to what do we want to do with our own community mental health center. And again, we have many departments within county that touch or provide or have something to do with mental health. And so I think it's important, and it was obvious, I think, over the course of time, important for us to have someone that could provide that leadership for us to pull kind of everything together and help us present a plan, a cohesive plan of what we're going to do. Deb comes with about 30 years of experience in the mental health arena, and I think to get us started or really kind of off the dime as to where we want to go, this would be a good step in the right direction for us to do that. So with that, do we have a motion to approve? Motion by Commissioner Rogers, seconded by Commissioner Morgan. Commissioner Kavanaugh?
Thank you. I don't know if Ms. Anderson is here.
She is.
Is she going to speak?
Not necessarily.
Okay, well, this is kind of popped up at the last minute. The proposal for a contract for anyone to do anything along these lines was never discussed in any of the ARPA committee hearings, which is problematic for the process that was established by this board and now is not being observed. So nobody in the public has had any opportunity to discuss this at all. The resume for Ms. Anderson reached us, the board members, yesterday after I asked questions in the pre-board meeting, which was the first we saw of that. The contract has broad duties, including creating a strategic plan to improve mental health services in Douglas County and facilitate all meetings of county commissioners and staff with members of the public, private, and nonprofit sectors in Douglas County, which is pretty sweeping. The salary, or such as it is, of $75,000 was never discussed. And so I guess my questions would be well, initially, Joe Lorenz, who's compiled, and I commend him because I keep track of them, a comprehensive book of requests. Did we ever receive a request from Ms. Anderson? Because I don't see it in our latest compilation, Joe.
No.
So there's been no request for these services like everything else that was considered or is being considered, and that's the process that was set up by the ARPA committee. which is now being discarded. There were no hearings on this, and I guess I would ask, and maybe Patrick would know, relative to this contract, who drew the contract up?
I put together a contract, I sent it to Deb and to the county attorney's office, and we worked together to come to an acceptable contract.
And so you negotiated, I guess, the $75,000 salary for this person?
That's correct.
And this was not discussed in any meetings that had to do with ARPA that we've held, correct?
Not at the ARPA meetings, it was discussed at the meeting we held yesterday.
Right, the first discussion was at the pre-board meeting where we went through the agenda item that this appeared in for today. The problem that I have is this is really sloppy procedure relative to a really important component of our ARPA funding, which I think, by all accounts that we've had so far, would fall into the purview of the process that we've established for all other ARPA funding projects, which is submit a proposal to Joe Lorenz, let's have a public hearing on it, people can discuss it. I have reviewed Ms. Anderson's resume that we received late yesterday afternoon, and it's replete with employment in the child advocacy realm, most recently with Project Harmony from August 2008 to August 2021. And it's fine from a child advocacy point of view. This is not a juvenile grant that we're talking about. This is ARPA for mental health, which is much, much broader. And you know, it would probably attract a wider audience, including our own mental health services, which employs many, many, many people that could possibly do the same work rather than bringing someone in to do a broad selection of very undefined things for a salary that
Time.
is far in excess.
Commissioner Maureen Boyle.
Yep, just a little bit, just to Commissioner Kavanaugh's point. I would like to, I did notice the resume too about how there is really, to be honest, I think impressive experience on what to do as far as children's health, and there is mental health involved in that. But Ms. Anderson, I would like to hear more about what the experience is in mental health, and specifically when you think about what the goal of this mental health project that the Douglas County Commission is undertaking. We really need somebody who can step back and see the forest through the trees. So I think I would appreciate if you'd speak to what your strategizing experience is, and just so I guess we can all feel more comfortable with who we're hiring to do this job. So like I said, I actually am impressed by the resume, but specifically I'd like to hear more about the strategizing experience, big picture experience, and then the part about the mental health aspect more specifically.
Yeah, come on down, Deb. And just state your name. Just state your name for the record.
Good morning, my name's Deb Anderson, and I'm happy to respond to your questions. I have a master's degree in social work from the University of Missouri. I have a PhD in public administration from the University of Nebraska at Omaha. And my specialization has always been organizational theory and change, and so it is very much of what would be considered a macro kind of a focus. I have a certification in strategic planning implementation, so I've done that with Region 6, with Region 3. I've conducted a number of strategic planning initiatives with other child advocacy centers across the country. My primary focus has always been really organizational change, but then when I went to work for Project Harmony, it's really been focused on child advocacy, as you mentioned. But a lot of the things that I did there as a deputy director were very macro-oriented. So I oversaw human resources, IT, data, grants. I wrote a lot of the grants, oversaw the program grants for the agency, along with I started and then oversaw all the prevention and early intervention programs. One of the things we learned very early on is that when you treat children, whether for mental health or other issues that they have, you also have to address the parents. And so the trauma-based, evidence-based treatments that we trained on and brought people into the community to train our mental health therapists in our community were really focused more on adults than they were on kids, with the idea being that if we can get parents in the place they need to be, then we're going to reduce adverse childhood experiences to children. So that is, even though my work was at a child advocacy center, a lot of the focus has been on the entire family. One of the programs we started there was called Connections. It's still going. It's a school-based mental health program. The idea being that oftentimes parents are more willing to seek mental health treatment for their kids before they will for themselves. But we always design that program so that if we can get the children in for mental health treatment, they are the gateway to getting the parents involved. So it has always been a whole family focus model, and that is the way we think is the best way to address mental health.
Okay, and then just along those lines, I'm thinking about the nature of this project is going to be looking at coordination between different organizations, you know, looking at our medical community, looking at governmental entities, looking at private entities. And so I guess because we've not met, this is our first experience, like Commissioner Kavanaugh, it'd be just nice to know what experience do you have with these different entities? And I like the organizational background, the strategizing, but how do we get all of these players at the table before we commit all of this money to mental health?
So part of what we would do is we'd work with all those different entities that you mentioned, which would mean focus groups, interviews, sitting down and talking with all the leaders, asking them who they would want to have involved in those meetings, gathering input from them. It's basically doing a needs assessment or an environmental scan of the mental health services that the county is providing. So that would be the strategy that I would use, and then that would come to this council, and then you would make the decision about where you want to go from there. I'm not sure that got exactly at what you were trying to get at.
Yeah, I just see this as an overwhelmingly huge project.
It is huge. Yeah.
So it's really how do we bring all the players together and make sure that each player has a role and has been listened to, basically.
Right. Yeah, that community engagement is critical.
Yeah.
I think one of the skill sets that I bring that I think was attractive to
Deb, time.
Oh,
We'll
sorry.
Come back. That's okay. Commissioner Kavanaugh?
Thank you. And thanks for coming today.
Yeah.
A couple of quick questions. I think the address on the resume is 12458 Caspian Drive in Papillion, Nebraska. Correct. Is that your home?
Yes.
The process that we've been going through has been going on for some time, and so I'm interested in how you were approached, or how did you come to present to us for this position?
Well, I have had, in my previous position, I had contacts particularly with Commissioner Rogers and Commissioner Borgeson.
Okay.
And so
that's
Commissioner,
fine.
okay.
We've got time here,
Okay.
constraints, so we got to kind of move through these. Have you been to any of our ARPA committee town halls, committee meetings, or the Douglas County mental health meetings that we regularly hold?
I have not.
How did you get to the $75,000 salary number?
It is a not to exceed amount. It's a pretty typical contract. It's just that it's a not to exceed $75,000. So if you see that contract, I would do billing, and it would not go above that amount.
Yeah. My question was, how did you get to that number? Was that your proposal? Was that the county's proposal?
My recollection is it was a combination in talking
Okay.
together about that.
Your resume doesn't indicate whether you are a corporation or any other
I'm
kind
a
of
sole
legal
proprietor.
entity. Sorry?
Sole proprietor.
Sole proprietor. This is a personal contract?
Yes.
You are not affiliated with the Project Harmony Child Advocacy Center any longer, is
No,
that
I'm
correct?
not.
Okay. So you're an independent
Yes.
sole proprietor contractor. Do you have any other clients?
No.
Thank you.
Commissioner Garcia?
Just a quick question, not necessarily for you, Ms. Anderson, perhaps for legal. Just, could I get a quick clarification on the page that says page 1, provision 2? The one that says that the contractor will facilitate and coordinate all county commissioner meetings with public, private, and nonprofit sector, except for county board meetings. Is the intention of the language there perhaps all county commissioner meetings as it relates to mental health? Because it doesn't say that. That's probably the intention, I'm sure, but perhaps that would be good to include there, because it seems like anything outside of county board meetings is what's actually included there. So could I get some clarification on that?
Tracy, York County Attorney's Office. I think that's a fair interpretation, Commissioner, although I would defer to the two parties that actually negotiated the contract, but I think you could add in some clarifying language if you wanted to.
It was specific to mental health.
Yeah, and I think that's evident in the resolution and the discussion today.
Yeah, it's in the resolution, yeah.
Thank you. Yeah, I'd feel just a tad bit more comfortable if it said that more clearly as it relates to mental health. Thank you.
Thank you. Commissioner Friend?
Thank you, Madam Chair. Dr. Anderson, thanks for being here. Do you envision as part of the consulting, I don't know if it's in the wording of the contract, but do you envision as part of it being analysis that would incorporate entities or organizations? I'm assuming that this would be true. Entities and organizations that should be involved in solving community-wide mental health problems. So in other words, there are certain things a county has to do, and I sound like a broken record, at least to my colleagues. There's certain things a colleague could probably shut up right now, but he won't. There's certain things a county has to do. We're mandated to do it.
Mm-hmm.
And a certain part of healthcare and a certain part of community mental health we're mandated to provide.
Correct.
Is this going to help us weave our way through some of this stuff? I mean, we should have partnerships with the private sector that's going to help us, and this will help us in that regard. But will your analysis help us differentiate between, hey, you guys, you're staring down the path of something 3 years from now that you're not going to be able to handle?
Yes.
You see where I'm going with this?
I do. I think part of what you're talking about is the difference between prevention, early intervention services, and acute care. And oftentimes when you're mandated, you can't turn away people. If people are coming into the county system, you have to care for them.
Right. If OPD brings them in, we're dealing with initial.
Correct. So that in and of itself will help narrow down the focus of what this work will be about.
Well, thank you. And as part of the analysis, between the mental health programs and services, are we going to talk about infrastructure a little bit? I mean, are you going to be heavily involved, or would you be if we move in this direction, heavily involved in discussion that we have to have about infrastructure in some portion of this town that's going to help us increase those services, right?
Yes, but in a programmatic way. And if it reaches a point where you're looking at construction, that kind of infrastructure will be handled by someone else. But in terms of programming, yes, the programmatic infrastructure.
Okay. Okay, thank you, Dr. Anderson.
All right. No other questions or comments? Commissioner Morgan, I didn't see your lights. Oh, there it is, sorry.
Ms. Anderson, I think you wanted to continue when you were talking to some others and cut off, and I thought there's some things you wanted to say. We could listen to that. It seemed like you had some additional comments.
Well, I really appreciate the opportunity, but now I've lost my train of thought about that. If there's something else that I could answer for you, I'm happy to do that.
No, I just wanted to be sure you had the time to finish whatever you were wanting to say.
Thank you.
Okay.
Commissioner Maureen Boyle?
to be honest with you, this seems to be happening very, very quickly, and this will sound weird to say, but I'm not sure that we've really had a chance to meet you and really get to know your credentials. We are having an ARPA meeting next week, and to be honest with you, I think it would help me if we could meet you better to know bigger picture instead of trying to slam this down into 15 minutes before we kind of approve the contract. To be honest with you, so I would I don't know if it's appropriate, but I would like to make a motion that we delay this until we meet at our ARPA meeting, delay approval, not to say we won't do it, but I would just like to get to meet you better to make sure that we're all on the same page, since this is a multi-million-dollar project. And so, I'd like to make a motion to delay approval of this contract until we have a chance, because we didn't even get your resume till last night. So just
I understand.
to be a good steward of it all and really, watch taxpayer dollars and make sure that we've got the right person, I would make a motion that we wait to approve this particular item until we have some more, until we meet again.
And I think next week we have a meeting, I believe at 1 o'clock. Chairperson can let me know that's correct. And then we could do some of that and put it on the agenda for next Tuesday, if that's acceptable.
I agree.
Maureen?
That's my motion, is that we have you come to our ARPA meeting on Monday, which is open to the public, and then we can ask those questions and have just more time to get to know the big picture, and just be more informed. And then on Tuesday, we'd be able to readdress this. So that's a motion.
Okay.
Yep.
All right.
Nice.
Thank you.
No other questions or comments? There is a motion to delay until our next ARPA meeting. Please vote. Oh, sorry, Larry. Sorry, I didn't see Larry wanting to speak.
Okay.
Larry Store, 5015 Lafayette. Omaha 68132. I want to get my 2 cents in here. I remember when the starting gates at Exarban would go off and the horses would race. I remember on my grandparents' farms when they took the cornmeal and stuff out to the hog trough, the hogs would all run for it. I remember FDR. I remember LBJ, all the great society programs, and American Recovery Act. Are we in a depression? Are we that bad off that we're rushing to the trough to take back tax dollars and give away, that we're now fighting with each other as to who's going to get it and what we're going to give it to, who we're going to give it to? Excuse me, but most of these programs, would they not survive if there wasn't the bank robbery out of the U.S. Treasury, which is also my tax dollars? They probably would not. People are using these for things that they shouldn't be using them for, only because you have to run to get the money before it gets taken by everybody else. On mental health, let me give you an example of something. I really don't conceive of a 911 call coming in and being properly screened by even a mental health expert. It's like you with mask on. I can't tell your expression, can I? Children can't. Maybe I can't even hear you because it garbles your speech. Now, my perception, for example, today, I don't know, did somebody call in the big guns here? The guy behind me I thought was a deputy, but I guess they report to him. But the 2 deputies report to you, and I just kind of perceived it. Oh, this is like little Lewis last week at the city council. I'm boxed in. Am I being closed in so that I don't rush the podium or rush one of you? Am I a threat, that much of a threat?
Larry, can you keep to the agenda?
Thank you.
Thank
That's
you.
the idea.
Thank
Please
you.
delay this.
Thank you. All right, with that, please vote. The yes is to lay over till the next ARPA meeting.
Motion passes 7-0.
We have a number of items for the ARPA funding approval by resolution, and we can take those all together or one at a time. But it's a mental health training for the 911 communications staff at $19,500. There is an ARPA funding approval for the Visiting Nurses Association Mental Health Shelter Nursing Program, $354,000. $165,000 for Omaha Integrative Care for mental health services, and $189,000 for well-being for a campaign to reduce mental health stigma. Is there a motion to approve?
So moved.
And we can talk about any of these since I read them all off at once, but there was a motion by Commissioner Rogers and seconded by Commissioner Friend. Commissioner Friend?
Or I think it was Commissioner Morgan the second.
No, your lights, oh, you took your light off.
No, well, I can.
Okay, go ahead.
Okay. Thank you, Madam Chair. This is going to be an interesting 7, 8, 9 months, maybe 15, 20 months ahead. It's going to be very interesting. The reason that for these particular items on this list that I've analyzed pretty thoroughly, and the reason for my approval is, and this will happen over and over again. Like I said, for the next 15 or 16 months, we're going to be going, where are you going? Why is the approval here? What did you see? What type of pressure do any of these things actually take off of government-driven community mental health issues or government-driven core responsibilities? The reason I'm backing these particular items on here, and we can do this every time we run through one of these things, if you'd like, is that we've got $55.4 million this year, $55.4 right next year. And right now, for this year, we have over $85 million in ask. So, of course, there's not enough money to go around. Get it? In my opinion, the best way to categorize these and to analyze them without doing too much of a stump speech is to actually go in to counties' core government functions. What is a county government subdivision? What are they supposed to do? What do they have to do? And the core responsibilities related to public health. What are we supposed to do? What do we have to do? Every one of these items on here, after my analysis, would actually help greatly, deal with some of those core functions and the mandatory things that we have to provide. Again, so in the next 13, 14, 15, 16 months, we're going to have to deal with corrections, because that's what we're mandated to deal with. We're going to have to deal with law enforcement. We're mandated to deal with stuff like that. Certain types of community mental health services from the feds and everybody else are saying, tap you on the shoulder, say, you don't have any choice. You've got to do this. Overall and specifically, what do all of these items in here help us with? When you do the research for Visiting Nurses Association and the Shelter Nursing Program, it's awesome. It's tremendous, and they're having huge problems. That's $354,000 budgeted, going right to them to try to help with their programs and try to help with the things that they're dealing with. 911 communication staff. Just a week ago, we talked about the problems that 911 has when they get a call at 9 in the morning to deal with a domestic violence call, right? Or something of that nature. That stuff's going to help. $165,000 for the Omaha Integrative Care Organization. It's a holistic approach to actually dealing with mental health problems. And it takes a lot of the burden off of Douglas County, right? And then finally, a resolution for $189,000 to the Wellbeing Partners, a campaign to reduce mental health stigma. Well, I don't know if you've ever been in a job and then suddenly you're gone for a while and you come back and you say, well, yeah, I had to go in and deal with some issues. This stuff's integral. And again, it takes the pressure off of the core government responsibilities that we have to deal with. I'll sum it up by saying this. Government doesn't do things very well normally. Yeah, they don't implement things in an effective and an efficient manner. All of these organizations on this list do.
1 minute.
They do a very good job of it. And we can analyze it and hand them money. I don't want to implement it. We're going to have thousands of these comes through for $110 million of ask. And we're going to have to analyze these. I think every one of these is pretty pertinent. I think it adds value. And I think we ought to move them forward and continue this, or at least continue this process in a positive way. I think they're positive. I say we move forward with it. That's my thought process. Thank you, Madam Chair.
Thank you. Commissioner Kavanaugh?
Defer to Commissioner Boyle.
Commissioner Boyle?
Yeah, and I'm very much in favor of these programs. At the same time, we're just now in the process of hiring a strategist for this, and so when we look at this, as much as I support these, I'm just wondering once again if we should just put them off for one more week until we have our strategist on board. It might be just a little bit premature if we're still trying to think big picture to start putting money at it, and so once again, I'm going to make a motion that we delay this for 1 week until we've got our strategist on board.
I'll second.
Commissioner Friend?
Thank you, Madam Chair. Commissioner Boyle brings up an interesting point. Remember, I said this from the outset, 55.4 million this year. We have 85 million in ask. So we can delay the inevitable. I mean, I don't have a problem if you lay this over. I'm not going to vote to do it. I think we need to get I've studied each one of these organizations. We also were in an ARPA subcommittee where we got a chance to actually visit with these organizations, and they told us what their mindset, what their goals and objectives are, and how they're going to actually use this funding. Now, you want to delay it? I mean, there's enough votes. Let's delay it. But this is going to happen every week, folks, the next 15 months. Every week. When we start distributing money, somebody's going to raise their hand and say, no, it doesn't need to go there. It's going to have to go over here. It doesn't need to go there. It has to go over here. I'm not saying that we're overreacting here. I'm just saying analyze the Visiting Nurses Association shelter nursing program on your own. I've done it. I took about a half a week doing it. Analyze the funding that's going to the Omaha Integrative Care Center. Analyze the well-being partners. That you can find all of these organizations out there. Go look at them. You want to delay this a week, go ahead. My thing is, I think that they would add value. I don't need a consultant to tell me that these are going to actually reduce the burden on county core government services that we're supposed to be providing. So if you're wondering what my conclusion is, I respect and appreciate this thought process that Commissioner Boyle's come up with. And if it's the will of the body to actually, postpone this, move it back, great. I don't see any need. I know what these organizations do. I mean, this isn't rocket science. Now, I guess that's it. I mean, I'd like to move these off of our plate. Thank you, Madam Chair.
Thank you. Commissioner Garcia?
What I'm interested in, of course, I'm playing catch up as the new guy, is what have we decided as a board comprehensively are our priority areas for funding. I'm glad that we're taking mental health seriously. I'm glad that we're investing in mental health, so I have no issue with that. I'm just wondering, what are the other priority areas that we have for utilizing this funding? Is it helping small businesses? Is it helping the homeless, those who are near homelessness? I know some of the funding has gone in that direction in the past, so I will be eager to learn first what are the priorities, and then have we set any funding levels for those priorities? Like, we want, out of 55 this year, we want 20 million to go to mental health, maybe 10 million to go here, 10 million there? Like, have we set any sort of parameters so that it's not like first come, first serve, we got these first, and we end up being a little lopsided on what we actually ended up funding? I'm also interested in the process for applying. I know we got letters from these 5 here, or at least the 4 we're talking about right now. Some were 1-page letters, a little more surface level. Some were 5-page letters, a little more extensive, comprehensive. They all, like Commissioner Friend said, do great work. I'm familiar with them in the community, being a nonprofit professional myself. I'm just curious about that process. I'd love to learn more about it. I'm going to save more detailed questions for Monday's meeting, which is about ARPA funding, so I won't delay too long here today. But those are some of the parameters and paradigms that I'm going to be eager to learn about. Also, how are we coordinating with the city of Omaha? I know that they are getting a similar amount of funding in this latest round. Is there any mechanism to know that the same nonprofits or the same entities are not applying to both sources for the same project? Is there any way to leverage our funding and their funding so that comprehensively we're tackling, what we need to tackle in this community, both at the city and county level? I'm just wondering what kind of coordination there is there. So again, not expecting answers necessarily today, but I'm eager to talk about that at Monday's ARPA meeting.
Thank you. And I don't know, Commissioner Kavanaugh, is this a leftover? Because it popped off and it, all right, Commissioner Kavanaugh?
Thank you. And I support what Commissioner Boyle's motion proposes to do with these. I'm really encouraged by all of our 3 newest members, very good questions and analysis in this. And I think that there's a consensus here that if we're going to have a strategic, well thought through process, and we have the basis for it, let's take a breath here and make sure that we do that rather than rushing piecemeal through programs and cart before the horse in terms of we just discussed with the person about coming in and helping us with a strategic plan, and then we're going to put 2 or 3 pieces of possibly that plan into it. So it makes all the sense in the world to do what my colleagues are talking about in terms of let's put this off until after the ARPA hearing next week, where we have a chance to hear from Ms. Anderson, go into some more in-depth planning in a just a logical, best practices, business-like way for this enormous amount of money. I mean, Commissioner Friend is exactly right. We're going to get these requests one after another after another. I have a whole book of them, and all of you do too, and they haven't quit coming in. So let's try to bring some order to this kind of pell-mell application process and put them through the committee vetting process, which is great. And I commend Commissioner Friend for going through these, and as a member of that committee, digging down. It's catch-up ball for some of us to get to perhaps where he is, and with a very new member in the last 24 hours, I think it makes all kinds of sense for us to just take a breath and go forward in an organized fashion using our committees and the public input that they allow people to come in and provide. So I would support this at this time.
No other lights. I won't be supporting the layover. I mean, you can't have it both ways. You can't take one agenda item and say it didn't go through the process, so you're not supporting it, and then you have others that went through it, and everybody had the same information at the same time to go through, however in depth they wanted to go through it. All of these went through the ARPA committee. All of them were on the Zoom, except for the last one. No, they were there. The last one was there. All of them were there and have gone through the process. But it does point out, I think, the importance not only of the community, but more so us, what we're going to do with our mental health services. And Commissioner Garcia, we did make a commitment to do county functions and then mental health as a priority. And when it came to, and I've had conversations with Commissioner Boyle about this, is that when it comes to the mental health piece, we're all over the board. And so bringing in someone that can help us to put that plan together, I think is prudent upon us. But again, these have gone through our process that we said we were going to do. And I don't think, again, having, it is money, there's some big money in here, but they do good work, and then for them to continue their good work and to, like Commissioner Friend point, to make an impact on what we do as a county, I think we need to approve these and move forward. Commissioner Boyle?
Yep, and just to be clear, I 100% agree with everything. These projects have been vetted. They did go through the ARPA committee. At the same time, to be honest, my point is really that we're only now hiring a strategist, and so more than anything, it's just to kind of keep the process clean. It really doesn't have to do with worthiness of the projects or the meeting we already had discussing these. So I think just my mind works in organized silos, and so for me, it just has to do with keeping the paperwork process clean. But so that's why I put forth the motion just to delay it for a week, just so we hire the strategist and then we start doing our work underneath the strategist. So that's my major point there.
Okay, I lost track. Okay, thank you. Commissioner Friend, I have you down with 2 dots, but I crossed off one, so I can't remember now. Does anybody remember if he spoke twice? No?
Mine is one long speech. So it's not 2 times. It's just one failing swoop. No, I don't need, that's fine.
Okay.
Sorry.
I'm sorry I lost track of that. Okay, so where are we? Did we have a motion to lay these over?
And is that, just for clarification, that's item 3, 4, 5, and 6?
3, 4, 5, and 6.
Just make sure we have that right.
And, well, I have a question time-wise. I mean, again, if you're going to now hook these into the conversation we had about bringing someone on, these could be delayed quite a very long time. So I just would ask for clarification for the maker and the second of this.
Ellen wanted to clarify, she did have that the delay was for 1 week, so they would show up on the board meeting next week.
Okay.
Or is that
Commissioner
not
Morgan?
correct?
I was just going to ask you. I just thought because of the new commissioner and also Maureen Boyle suggesting this, is there any harm if it's for sure 1 week? I mean, I know that we have reviewed these, but I just thought as a courtesy. But if that's what I'm asking, Commissioner Borgeson, do you see any harm if it is 1 week period?
I guess I'm going to rephrase that. I don't see harm, I don't see need, because it's 1 week. So nothing's going to change if the argument is they want the strategies person, the consultant potentially, if it's approved, on board. That's going to take more than 1 week. So these will be delayed for much more than 1 week, in my opinion. So again, if it's the process everybody was concerned about, we went through the process with these
Right.
4.
I know
And they
that.
did what they were asked to do. And this board did what we said we were going to do. And so I don't think it's fair to delay these. And again, I don't want to use the word harm because I don't think it's, quote, harm. I think it's more in line with what we said we were going to do and doing it. Okay. So the motion has been rescinded.
Okay.
We do have a motion, which I believe if I go back, it was Commissioner Rogers and Commissioner Friend that seconded it.
Madam Chair.
Did you have that?
If you can you do 6 separately? I need to abstain on that.
Yes. Oh, yeah, that's right, you're on the board. Okay, so we have them, why don't you let's redo a motion to approve 3, 4, and 5.
Yes, so move.
Second.
Any questions about 3, 4, and 5? Please vote.
Motion passes. All commissioners voting yes. Commissioner Kavanaugh is abstaining.
Is there a motion to approve item 6?
Move for approval.
Is- Mo-
Six was in there.
No, we just took it out.
Sorry, I would ask for my vote to be changed to yes then.
Okay. We'll update the record.
And so now the motion, I need a motion to approve item 6.
I made a motion to
Oh.
approve item.
All right, Commissioner Morgan, and seconded by Commissioner Friend. Please vote.
I have a question on.
Oh, I don't see your light on here?
Oh, I didn't.
Oh, okay, all right. Commissioner Kavanaugh?
Okay, so I can go along with 3, 4, and 5, although I think it'd be better, make more sense to put the horse before the cart in terms of our strategy and then our programmatic implementation. 6, there's absolutely no reason to move ahead with 6 right now. I mean, that's an individual we're giving $189,000 to do. Kind of a program that really should be vetted. I was at that meeting, and reducing mental health stigma for $189,000, I think, is something that probably should really be discussed in terms of the overall strategy. This young woman came to us, and my hat was off to her. She was in her home, in her kitchen with her child, and proposed that we give her $189,000 to reduce mental health stigma. I think that these are the kinds of things that if we go down this road, we can, really have problems putting money out there, that there is no absolute need for us to do this today without consulting a $75,000 consultant that we're planning to bring on board for the strategy of this. So when I voted before, and I've asked that my vote be changed to support for 3, 4, and 5, those were a little different than 6. 6 is really, there's a question of whether or not that fits into our priority for mental health overall for $189,000 for kind of a amorphous program. I'm not saying that it's bad. I'm just saying I sat through that hearing and I looked at these backup documents, and it's kind of like what Warren Buffett says about investing in stuff. If I don't understand stuff, I don't invest in it. Well, I'm not sure that the documents
After mine.
add up to $189,000 of our hard-earned taxpayers' money for a mental health thing that, we're going to have much, much bigger, more immediate, here are people that are seeing doctors and are occupying beds in our facilities, mental health things, than something like this. So that would be my, let's at least lay this one over idea would be there's no fire, and not having this $189,000 go to this young woman today doesn't cause the community any hardship, but it might down the road be $189,000. It might be something to consider in other mental health contexts that we would come across in our strategic planning process that we're going to invest in. So I would move to lay that one over. And, in order to give us an opportunity to discuss it in committee, make it next week.
No, right. This is on a new item, but there is lack of a second on that motion. We'll move to Commissioner Friend for comments on the item.
Yeah, thank you again, Madam Chair. I wanted to make a quick clarification because I don't think I made it earlier on. There's value in this mindset and this thought process to bring consultants in. We do it all the time. We'll probably do it again. But I'm going to be so bold and so arrogant to say I don't need the consultant standing in front of me to make a value judgment on whether we think a program is going to be decent or not for our community. And Commissioner Kavanaugh just made a valid argument that Section 6 or Item 6 and the well-being partners needs more analysis. Well, we can have that discussion, and maybe more analysis is needed, but it depends on the will of the board. I don't need it. I've investigated this, and look, again, let me just reiterate one final time. This will be every meeting we have, because there's going to be winners and losers here. Somebody gets the money because they do good work. Somebody doesn't get the money. And by the way, they do good work too. So we're going to have tons of winners. We're going to have tons of losers. And delaying it? I mean, I guess. Do we want to not give them the money this week and then give it to them next week? Or do we not want to give them the money this week and not give it to them next week? I mean, who jumps in front here? We vetted these guys in a ARPA subcommittee meeting. I don't know, you guys. I mean, all I'm saying is in the next 13 or 14 months, we're going to be doing the same thing week in and week out, and we're going to be picking the winners and losers. Pick this winner or this loser right now. Go ahead. I don't need the consultant to tell me that these guys are doing good work. So I guess I'm not saying Commissioner Kavanaugh's wrong. We'll see what the board, decides to do. But I am saying that there's an inevitability here. As time goes on, these arguments are just going to continue and continue and continue. We can't get rid of them. It's going to keep happening. My point is, I think we better get used to it. So we're hired to make decisions. We're hired to make decisions for our constituency. I would respect the decision that Commissioner Kavanaugh makes and all of you guys make. I just don't see any reason to delay these things. Let's get these things moving if we have the capability. Thank you, Madam Chair.
Thank you, and I just want to make one clarification. It's not giving money to the young lady who was on the ARPA committee. She was representing an organization, Wellbeing Partners, that was formed back in 2020 with the combining of two organizations, Live Well Omaha and WellComm, who have done work in the community for many, many years. The proposal was very much, very in-depth in what they had already provided in terms of a stigma reduction campaign and what they want to continue to do with that $189,000. They actually have over probably 100 and, I think the proposal said 120 some partners within within Douglas, Sarpy, Cass, and Potawatomi to work on this campaign. If you go back and you listen to our listening sessions, whether it be from the Region 6 providers, can you turn the thing on, please? Sorry. It should probably be 4 minutes now. If you go back and listen to the comments that were made from the Region 6 providers, in the network and the community providers, and then mostly from our public, one of the reoccurring themes over and over and over and over was we need more work done on reducing the stigma around mental health. That is what this organization does. The young lady who presented was CEO of this company that came to ask for these dollars, and they have a whole slew of other organizations in line to ask for dollars as well. So I just wanted to make sure that people understood it wasn't that one young lady, as Commissioner Kavanaugh was stating. It was the Wellbeing Partnership organization that was asking for this money. Commissioner Rogers?
Thank you, Madam Chair. And just to fill in a little more, I'll be abstaining because I sit on that board, but I missed the meeting where this was moved up. But I just like to tell everybody that this is actually before ARPA. When the organizations got together, every 3 years, the county health department does the community needs assessment. This is the third year. and this is the year that we put it back out in the field. So this assessment was done out in 2018. And from 2018, one of the leading issues of the assessment was mental health in general. In addition to the responses from that survey that were put out to the community, they were put out to Douglas County, Sarpy County, and Pottawatomie County in the greater area. In addition to those, the well-being partners partnered with the health department to go around to the areas in the counties and do some in-depth listening sessions from north to south to other areas, and they over-sampled and represented the areas of color to make sure. And the overwhelming response from those meetings was mental health, and it got more detail. So, as I said, the program started with an investment from a private donor, and this is a one-time hit to continue and finish out that campaign. But note, it's not just our money. Sarpy County is putting in money from theirs, and Pot County is putting in theirs. So there was a comment made earlier, I forgot by who, but the money is being leveraged to do it. So I just want to add that information on the record.
Okay, Commissioner Kavanaugh? I don't know if that was left over from Commissioner.
Well, I guess procedurally, I don't know where we are. I made a motion to just lay it over.
There
for
wasn't a
week.
second, so it died for lack of a second.
Okay.
And, okay, so there's no other lights on. There was Commissioner Maureen Boyle.
Yeah, just to reiterate what Chair Borson's saying, looking at the information that they provided, a couple things is we like to be outcomes based, and per the document, the macro outcome of mental health campaign is a reduction of mental health stigma by 10%, improvement of access to mental health resources. And so I think if we can see that type of data in the information that they give us, I think that helps. That's first. So it sounds like they're outcomes based, and they have the data to support what they do. Number two is this isn't a mom and pop shop, but they've got they've engaged 130 organizations in this effort, and so I think, and they've got 50 organizations that are coordinating all of this. And again, I think when we talk about trying to have mental health strategies, this is a situation where they're strategizing how to get the word out to decrease the stigma. So they are the forest. They are the forest, and they're getting the trees together. And so I appreciate organizations that can put it all together so it's not so piecemeal. And they've got a lot of big companies that they work with. They've got Mutual, First National Bank, Methodist, EAP program, employee assistant programs. And so I think with that, this isn't just a small little initiative that we're helping fund. This is actually kind of a big organization, and I think that's what helps make me support this.
Make the motion.
There is already a motion and a second. So, let's see, please vote.
Sorry, I need to abstain.
Motion passes. We will set the record to show that Commissioner Rogers abstains.
And he stated why he abstained.
Yes, he did.
Just so
Yeah.
my vote on the 3, 4, and 5 is yes. Madam Clerk? Yes, thank you.
On that subject of reducing the stigma, I do want to just take a moment and let you know that I've been working with Leah to do our next board's listening session, and it is centered and focused around that stigma reduction issue. And so we hope to have that, I think we're looking at the 9th potentially with the public. So again, more good information that will help us. With that, we'll move to Human Resources, the weekly personnel from Civil Service as presented. Legislative, we do have need for an executive session for litigation and labor negotiations.
Motion to go into second session for litigation and labor.
Is there a second?
Second.
Motion by Commissioner Rogers, seconded by Commissioner Friend. Please vote.
Motion passes
Recording stopped.